Good morning, everyone. It is a pleasure to be here at this conference on ethical competence of future nurses and midwives. Thank you for the invitation, especially Professor Rogério. A special greetings to Professor Lucília Nunes and to all participants. I'm truly delighted to be joining you today. In this presentation, I'm going through 4 points. Sorry. I need to put more sensibility, more crazy. No. Well, okay. I will find another way. I'm sure. Okay, no way. Okay, sorry. Again, in this presentation, I'm going through 4 points. First, a general overview of the concept, citizen engagement, and how this can be applicable to healthcare, education, and research. Point 2, I'll share my professional experience, more specifically in research process. Point 3, I'll discuss the ethical issues that arise when this new approach process and how these ethical issues can offer some interesting perspectives for your project, ETHCOM project, if you want to use this approach, of course. And at the end, point 4, I'll explain the possible relationship between some of the ETHCOM project's objectives and citizen engagement. To kick off this point 1, let's begin with the first question. What is citizen engagement? Well, are we talking about community participation? Yes, we are. It's true. Are we talking about community involvement? Yes, could be. The concept of engagement or involvement are considered to have the same meanings by many authors. However, the level of intensity of the partnership could be different. So engagement or involvement, it is opposite the individual work. So that is what citizen engagement is, but also it is more than that. It is something that brings us together to solve problems that affect each of us. To convey my point more clearly, allow me to be more specific. Another question to consider is, in which situations could citizen engagement be applied? In all sectors, in specific sectors? Well, as we know, no place in the world is perfect. Every community faces a unique set of challenges. In this way, these challenges, problems, whatever, can range from corruption or pollution to unequal access to education, scarce affordable housing, hungry, or even a lack of quality health care. Therefore, another question we may ask is, who is responsible for solving this problem? For example, corruption or quality of care. Is it academic institutions, local government, business sectors? Well, all play important roles, but the reality is that no single sector can solve all community challenge by itself. That's why community needs dedicated individuals working to handle local problems. So every sector is essential for maintaining a healthy society. And of course, citizen engagement shouldn't just happen in health systems, but in all sectors of the community. So in conclusion, we can say citizen or civic engagement is when someone takes actions to improve their community and encourage others to do the same. But we don't how this does relate to health education, or health research. What is the bridge? What is the relationship? The first idea to say this collaboration is learning. First of all, let's focus on citizen engagement in the health sector. When we discuss citizen engagement in this context, we often come across other terms such as patient and public involvement, often call it PPI, in research process or in health or in healthcare, patient activation, patient and family-centered, etc. In reality, in recent decades, there's been a growing partnership between citizens and healthcare professionals. Experts, authors talk about the partnership area. Citizen engagement is becoming a holy grail or the next blockbuster drug of the center in healthcare. This collaboration is crucial for improving healthcare outcomes by and ensuring that the treatment or the care truly meets the needs of the patients and their family by many experts in this area. There are several areas where this engagement is particularly evident in many parts of the world, in many parts of the health system. For example, actively involve patients in their own decisions and health care management, integrating patients' perceptions to improve the quality of health service, or in organization level, involving patients in decision-making process in healthcare organization. Canada is a good example where this happens, but USA is too. Let's look at some organizations that are leading this engagement in different ways. First, we have the Patient Advisor Network, or also called Patient and Family Advisory Councils, etc. Could have different other names. These, in some cases, are led by patients themselves, and the first-hand experience and insights are invaluable in making meaningful change. By doing so, they ensure that the broader context of the patient's care is considered. And of course, research has been carried out into the impact of these patients' advisor here and articles that evaluate this impact. The impact of the patient advisor on healthcare outcome, a systematic review, secondary study. For those who may be more interested in this area, here a multidimensional framework for patient and family engagement in health and healthcare. This frame is interesting because all authors categorize the type of engagement and the level of that engagement. Another area is education. Maybe some of you know that patients are increasingly involved in development of the curriculum for health professionals. It means the patients are teaching, patients are training of different types of the students, such as nursing and medicine areas. That means the patients are the professor, are the educator. Another area is technology assessment. In this area, that has already been explored a lot, but of course, there are also different levels of engagements, like this article warns. Patient and public are important stakeholders, is health technology assessment, but the level of the involvement is low. Here, in my opinion, technology assessment, we enter in the research field since there is a develop of the product and a develop of the knowledge. And lastly, research. I really like some slogans that help us understand what is PPI in research process or citizen engagement in research process. A good example for me is a slogan, "Nothing about us without us." So PPI could be defined when patients, caregivers, members of the public are active partners in research rather than subjects or participants of research. It is about research with or by, not doing research to, about, or for. However, the PPI is something incipient in some areas. Indeed, in health, we have long-use patients and participants in research, but we don't consider them as a member of the research team. In some areas, some fields, such as social and health science, research is usually more focused on researchers' opinions, researchers' idea. In fact, the ordinary citizen have the greatest ability to bring to society what they really need, what really interests them, even in research field. Perhaps we need more balance in the way we develop research. Let's look at some organizations that are leading this engagement in research. We have the patient-centered research institutes or units, who have different names, of course. These organizations develop or help develop PPI, and a lot of research has been published on this subject. Well, what I have done and what I've been doing. My work has been centered on developing PPI in research process. In 2020, I took one new challenge in my career as a researcher at the Health Science Research Unit, which we call Deze, from here at the Nursing School of Coimbra. First of all, to say that this unit is evaluated and funded by FCT, which is the maximum entity of science that is carried out in Portugal, and this unit, we see that, has a really good evaluation. This unit has a specific model for organizing and managing research and develop and innovation activities. Each we call it the transversal model. This transversal model includes, among other aspects, 8 strategic axes for its development. One of these axes is responsible for engaging in the process of doing research citizen, but also for obtaining better knowledge for society. And then I began my work in this area. The team grew in addition of other members, such as Elena Santana, Joana Bernardo, she's here. Currently, I no longer coordinate these strategic axes because new challenges have arisen. It is coordinated by Professor Silva, and the work that has been done has been truly outstanding. Broadly, a systematic work has been developed in this axis, which is organized in 3 pillars or 3 action lines. Identification of the needs is pillar 1, in order that in this pillar is focused on helping research and citizens to implement this good practice in their research. So we try to identify what the researchers or citizens need to know to implement PPI, what tools or what the structures. In pillar 2, implementation process and dissemination, it is focused on the implementation's PPI approach, citizen engagement approach, but also developing science about this approach. So in this pillar, we are interested in knowing what are the best models, what are the best methods to do this. In pillar 3, monitorization, where that is continued evaluations of Pillar 1 and Pillar 2, it is focused on designing strategies to assess the impact of change and implement solutions to ensure sustainability. What are the benefits? What are the impact of the PPI? Of course, we only identify the needs if we have awareness about our own needs. Thus, in Pillar 1, we developed several activities for awareness, but also knowledge transference and training made for researchers and citizens through the webinars, lectures, social science festivals, national and international conference, but also writing about the subject through publications, the editorials, newsletters, and review papers. In Pillar 2, products are co-created with the citizens, such as evidence summaries for citizens on topic they have request, for example, or supporting others, researchers in preparing applications, proposals for competitive funds in PPI sections, of course. Well, to conclude, we are focusing on creating tools that help research foster citizen engagement, but it is not just about engagement. We are also looking at how this engagement happens. Essentially, we are involving both researchers and citizens in this process to ensure it is effective and meaningful. Currently, I also coordinate a project about open science in which citizen engagement is one of the fundamental dimensions. Another important challenge I have been involved in that have opened my mind and give me experience in this area are different types of the project, like the Netcourage project, Cherish project, and Adam project. And well, in this path has allowed me to realize that are several ethical challenges in using this approach in its different areas of the activities. What this experience led me to reflect on when I think about citizen engagement and ethics. Ethical consideration arise when citizens, scientists or citizens, educators are also patients or caregivers, as they are reporting their own data, they reporting their own experience. Of course, this approach differed from traditional research. Therefore, in community or public engagement, one of the primary ethical questions is about the ownership of the data, ownership of the knowledge generated by this collaborative work. This shared ownership means that researchers need to adhere certain principles, ensuring that the community's rights and contributions are respected, visible, valued throughout the research process. Indeed, it is essential that equity and rights are respected in their participation. Fair treatment and appropriate compensation are vital for maintaining ethical standards. It is necessary to set clear and achievable expectations for citizen collaboration. In fact, we need to put on the table legal and ethical questions about copyright, intellectual property, agreement on the data sharing, confidentiality, as well as the limitations and device of this approach of doing science and improve health and education system. I would like to talk about your project, strengthening the ethical competence of future nurses and midwives. Congratulations. Maybe my ideas, it's not new for you, but what I think in the initial part of your presentation, we are aligned. First half, congratulations, is very, very interesting initiative. I agree totally that the ethical and legal principles and professionalism are nurse educator core competence. I read through some of the project's objectives and later reflected on them, relating them to citizen engagement. From these reflections, I've come up with some ideas that I think are innovative or could give a stronger project and could help guide the members of this consortium as they decide on the path you want to take. Especially for the objective 3, safeguarding the impact of the co-created experiential training methods by ensuring the inclusion of all stakeholders group. So, firstly, civic engagement in ethical is crucial. By involving the community, this project can identify the real ethical and practical needs of nurses and midwives. This could ensure that the training and education provided are not only relevant, but also impactful. Secondly, regarding the organization of curriculum, I think you need to align them with the ethical needs of the community, citizens, and nurses. This alignment ensures that what is being taught is truly beneficial and meets real-world requirements. It must also include real challenge in the curriculum. This means incorporating models or units that reflect that actual challenge and expectations of the patients and their families by using, for example, direct feedback from citizens. You can make training more practical and effective. Finally, the roles of the patients and the families is essential in constructing this curricula. By doing them as a co-creator, the project ensures that the training is aligned with diverse interprofessional and cultural realities. This collaboration or partnership can help create more holistic and inclusive educational experience. I would like to reflect on some specific methodologies. So you can develop simulation or case studies based on interactions with diverse stakeholders group, including patient and special needs. This approach could help future healthcare professionals understand real-world scenarios and develop practical solutions. Next, the students can implement community service project as a part of the training. This allows students to confront ethical dilemmas in real-life context. Additionally, the project can integrate civic engagement strategies into interprofessional training. By doing this, the project promotes a holistic understanding of ethical needs in healthcare, ensuring that all students or professionals are involved are well prepared to face these challenges. I also would like to propose the creations of the advisor panel as suggestions. This panel comprises the patients, families, and others committee members who provide ongoing feedback that helps validate and refine their ethical scenarios and simulation. On the last idea, the project can organize co-creations workshop with the citizen. In these workshops, citizens will work alongside nursing and midwifery students to create solutions to ethical dilemmas, identify the simulations or real-world scenarios. Finally, I hope the ETHCOM project remains committed to the continued inclusions of the civic engagement. Congratulations again. Thank you.